It's unfortunate that so many people and even so many doctors still believe that calcium supplements are going to improve your bone density, prevent osteoporosis, help correct osteoporosis, and they won't. And they're dangerous. I've done a lot of videos on the dangers of calcium supplements, and I'm not going to talk about that here other than to mention that one of the many hazards of taking calcium supplements is heart disease and heart attacks. Meanwhile, nothing is really being done about the bone density problem, other than the prescription medications, which have horrific side effects. So I'm going to give you a list of things that are science-based. They've been researched scientifically, they've been used clinically, I've used them with my patients, and they really work as far as improving bone density and preventing bone density loss. This is science-based healing at its finest, because bones are not just made of calcium. Calcium is one of the constituents of bones, but there are many others. And calcium deficiency is not the cause of osteoporosis. So let's begin with vitamin D3. And a lot of doctors do recommend vitamin D3. The problem is almost never do they recommend taking adequate amounts of vitamin K2 along with it. And vitamin D3 should never be taken without vitamin K2. And when I say adequate amounts, here is the ratio. Write this down. For every 1,000 IUs of vitamin D3, 100 micrograms of vitamin K2 in the form of MK7, not MK4. So if you take 5,000 IUs of vitamin D3, you take 500 micrograms of vitamin K2, MK7, also known as menaquinone. Next is magnesium glycinate. Next is zinc. Then there are two other minerals, boron and strontium. Then there's type 1 collagen in the form of hydrolyzed collagen peptides, type 1. Because collagen constitutes somewhere around 35% of your bone matrix. And in osteoporosis, what happens is the bone matrix breaks down. The bone matrix is what holds the calcium in place. Next would be tocotrienols, and that's a form of vitamin E. And then vitamin C. Now, I'm not a huge fan of plain old vitamin C supplements. I like to take them in a whole food complex, and I recommend normally either camu or kakadu plum powder. Camu is a fruit from the South American rainforest. Contains anywhere from 30 to 60 times the amount of vitamin C of an orange in a natural context with all the cofactors to help your body assimilate it. Kakadu plum is a fruit from Australia and I believe also New Zealand, and it's another whole food complex. It contains somewhere around 100 or more times the amount of vitamin C of an orange, and I will tell you that it tastes better than camu. Now in osteoporosis, especially in postmenopausal women, there's a huge hormonal component, and I'm not a fan of the synthetic hormones. We know they are dangerous. That's why so many women will say, I don't want hormones, I'm afraid of hormones. What they're really saying is, even though they don't know it, they're afraid of synthetic hormones. You shouldn't be afraid of hormones, because without hormones, we can't live, we can't survive. Hormones control so much of what happens within our bodies. And of course, we need adequate amounts of hormones, and it's hormone deficiencies that result in osteoporosis in postmenopausal women. So if you find someone who will do saliva tests and urine tests, alternative testing, not just blood testing, because blood testing doesn't isolate the free biologically active portion of the hormone. It tests all of that particular hormone in the bloodstream, and that doesn't help. And most doctors just use the blood test, not really relevant information. So find the right doctor who performs alternative types of testing that test the biologically active portion of the hormone and uses bioidentical hormones and herbs and other natural medicines to assist the body in resuming normal rate of production of hormones. So there you have it in a nutshell. Again, I want to reiterate, because I talk about it a lot, that calcium supplements are extremely dangerous. And in the Nurses' Health Study, they found that the women who consumed more dairy products had substantially more fractures than women who didn't. And that's commercial dairy products. That doesn't apply to raw dairy products. That's another subject.